Are you experiencing severe upper abdominal pain, particularly after eating? Well, you might have gallstones. My name is Simon Monkhouse, consultant upper GI surgeon based in the southeast of England in Surrey. Now, gallstones is a very common condition and it can affect anyone. The causes of gallstones are not entirely known, but what we do notice is there's a strong link to diet. There's a very strong link to changes and fluctuations in weight, whether that's fluctuations in weight from things like Weight Watchers or more recently the weight loss jabs or post-bariatric surgery, for example. It's very common in those groups of patients. And it can also be genetic, and we do see it running in families. In order to understand the problems that gallstones may cause and the treatment options, I thought I'd just do a very quick explanation of what gallstones are and how it all fits into your digestive tract. So I've got a little diagram here which might be helpful. So this is your anatomy. So you've got your stomach, your liver, your gallbladder, this thing's called the bile duct, and your pancreas. So whenever you eat food, food comes into your stomach and your stomach sends signals to the liver and the pancreas to produce digestive juices. So basically your stomach says, I've received food and I need some digestive juices. Your liver is told to produce bile and bile comes down the bile duct. Your pancreas is told to produce pancreatic juice, and that comes down the pancreatic duct and into the bowel, and these two meet together, meet the incoming food, and you start your digestive process. The gallbladder is essentially a little reserve tank that stores bile that's made in the liver and stored in the gallbladder. So the gallbladder is not making anything, it's just storing it. When you get a incoming food that's very fatty, your stomach is very clever and it says, I need more bile than normal to help me digest this fatty load. So what happens is signals go to the gallbladder as well as the liver, and the gallbladder is told to squeeze out its contents, and you get an extra rush of bile, and that helps meet the fatty food. So in reality, the gallbladder is emptying and refreshing on a regular cycle. When your gallbladder is not working, that cycle is impaired, and basically the bile in the gallbladder just sits there and stagnant. And if you imagine you had a pot of muddy water, the mud would all settle down and settle to the bottom. The same is true in the gallbladder. The bile, salts, and crystals are all settling to the bottom because the gallbladder's not working and it's not flowing that bile. You then get sediment in the gallbladder, like grains of sand, and these coalesce together and form stones. So it's the gallbladder not working that leads to stone formation. And it's the stones that cause the problem. So the gallbladder is the source, the stone is the thing that causes the problem. And if you look on my diagram again, if you have stones in here, what they can do is they can get stuck in the neck of the gallbladder, and that gives you severe pain. That's called biliary colic. Or a stone can come out of the gallbladder and get stuck in this tube here, the bile duct, and that can give you jaundice, and that can be very serious. And also a stone can come out of the gallbladder and get stuck in the pancreas and give you a condition called pancreatitis, and that too can be very serious. So gallstones are not just a niggling pain that affects you every now and again. They are a potentially serious problem that can lead to serious consequences. And unfortunately, every year, a very small percentage of people who get pancreatitis secondary to gallstones don't make it. And, after a period on intensive care, don't survive. So there is a mortality risk associated with gallstones. So the treatment for this is, as soon as you have a diagnosis and you're getting symptoms, it is a good idea to have a consultation and have a discussion about what to do next. Because when you are getting the niggly pains but have not been admitted to hospital, you're in a really good zone to think about having surgical treatment, because you want to get ahead of this problem rather than be reactive to the problem. The surgery is day case surgery usually, and it's keyhole surgery, so very small incisions. And on my diagram here, I've just drawn the rib cage and the belly button. So what you have is 3 tiny little incisions along the rib cage and 1 in the belly button. So we're talking 5mm incisions, and they heal very quickly. Day case surgery, in and out same day, full anaesthetic, so you are put to sleep. You don't need your gallbladder. So we are removing an organ that has already declared itself as not working. You don't get stones by having a functioning gallbladder. So we are removing an already functionless or poorly functioning organ. And that usually means that people don't get any consequences of removing their gallbladder. However, there is a small percentage of people that may experience some digestive problems afterwards, such as bloating or diarrhea, etc. And we would go through this thoroughly with you in the clinic setting and ensure that you had full consent and awareness of all issues. But the vast majority of people have their surgery, recover within a week or so, and are back to full fitness by 2 weeks post-operatively. And then they can get about their daily business, knowing that they're not going to have potential devastating consequences of gallstones. So if you have a diagnosis, and we usually diagnose by means of a simple ultrasound scan, then I'd be delighted to see you to discuss that in more detail and to determine what options we have for treatment. If you are found to have gallstones but have no symptoms, so for example, it's found on a scan because you're being scanned for other reasons, you don't necessarily need to have surgery, and we can do a watch and wait policy. So there's not an obligation to go ahead with surgery because you have stones. But if you have symptoms strongly suggestive of stones, that's a real good indication that you're likely to get further symptoms and potentially a hospital admission with one of the problems we discussed earlier. So don't sit on your pain, get it looked at, and I'd be more than happy to see you.